Hello and welcome to summer. I wanted to make two comments uh, about summer and some prevention work that I think is useful to discuss. So first, just as background, I, treatment always follows diagnosis. So understanding what's going on with a person is always useful, always necessary to be able to get the best treatment possible. That's one general comment in medicine. The other one is prevention is always better than treatment, always. And towards that, I wanted to make a couple of comments. So, one is to remind us that in about 5 years ago, in 2020, I put out a video of how to make filters to clean the room. The reason I usually use that is for the fires that exist in mostly on the west coast of the United States, but fires anywhere where there's so much fire and so much smoke and so much particulate matter in the air that when it comes into the house, it affects people's health. It affects their breathing, it affects their mood, it affects their cognition, it affects them in a lot of allergies, it affects them in a lot of different ways. And so removing the particulate matter is I think very, very useful and has always been very useful. And especially in those circumstances, also removing viruses and bacteria in the air, also very useful, especially in situations where people should not get sick. For example, really old people that can become profoundly ill with this virus or that virus, and just removing that likelihood or the viral load that's in the air is, I think, quite useful. So I put together a very short uh, film that allows you to create a filtering system like that for just $50, and it works as well as any $2,000 filtering system. And you can therefore have many of them throughout the house and be able to sustain, to be able to breathe clean air and not worry about those things. So that's the first thing I wanted to say. Okay, then the second thing I wanted to talk about are ticks. So beautiful grass, beautiful walks in the woods, and you potentially can get a tick. So obviously preventing ticks from coming on you by using protective clothing and whatever sprays or whatever else you want to use around you is very useful, very important, as well checking yourself for ticks after that event, I think is very, very important. Also, if you have animals, dogs, and so on, that ticks might hop on and off of, I think also very important. Aside from that, sometimes you get a tick on you, and then what are you supposed to do with in that situation? So first, I'm going to go to the CDC website, and then I'm going to talk about um, my my perception of that. So this is what they say for on the CDC website, at least in for the last so many years. Avoid tick testing. People that have removed the tick sometimes wonder if they should test the tick to see if they're infected. Here's why the CDC does not recommend it. First of all, some laboratories or many laboratories don't have high standards, and so the results might not be uh, valid. Secondly, a positive result doesn't mean that you got infected. Uh, Third, negative results might lead to a false assurance. For example, maybe you found this one tick, but maybe you had 7 or 8 ticks on you, and you're not aware of that, of them having been on you. And so testing one and having it be false is it might give you a false assurance because the one you test might have nothing, no bugs in them, but other ones might have. And then the last one is if you were infected, you probably will develop symptoms before you get the results. and you should uh, so you should not wait for the tick testing to the results because before looking for appropriate treatments. So that's the suggestion. I'd like to talk about why I disagree with that. Okay, so first, I totally agree that there are different labs and that they might have different criteria and that might be valid or not valid. And it might be sort of slipshod work, and what the results you get might not actually reflect the realities on the ground. So I totally get that. Uh, Also, I believe that if it takes you a long time to get the results, that's not particularly useful. I mean, it is useful in some respects, which we'll talk about, but it's not really actionable at the time of where you have to make decisions. So I agree with that as well. The things that I don't agree with is what if you can take care of some of those deficits? What if you could know if the tick was carrying something? So here, again, treatment follows diagnosis, and we might find ourselves. I'll give you a few examples. You might find yourself in a situation where you found a tick that was embedded, that was engorged. You removed it, and then a week later or 2 weeks later, you get the flu. But you don't know you have the flu. You just feel body aches and fever and so on. You call your physician, and you tell the physician, I feel terrible. And they say, well, there's a flu going around, or there's some virus going around. Oh, you also were bitten by a tick. This could be Lyme. Let's order the test, and when we order the test, we'll find out what's what. But until then, take this or that antibiotic. Or even before you get sick, it's a week out, and you tell your physician I was bitten by a tick, and they say, "Well, let's just take antibiotics just to prevent any potential. Let's do a 2 week course, a 10-day course, a 1 month course, whatever it is." So that situation exists. So for me, I think taking antibiotics when you have to take antibiotics, fine. We're not going to talk about that. But we do know that taking antibiotics changes your gut biome. It changes your all your biome. And that if you're going to take it when you need to, but not if you don't need to. And we also know that it can take months or even a couple of years to get your biome just where it was before taking the antibiotics. So if you don't need to take it, don't take it. But if you do need to take it, fine. Okay, I understand that situation. Um, so the physician is hampered by not by sort of a guesswork. Well, he was bitten by a tick. It was engorged. It was, which means it was on there for many hours, and the potential for transmission of the bug existed. Fine, okay. Uh, we should treat it because we don't know if the tick was carrying a bug or not. Also, it's tricky testing individuals for Lyme because in most instances the test is to check for antibodies, which means you get bitten, you get a reaction, and then your body has to deal with that. Your body has to react to that bug by creating antibodies. And so really the best time to test for if you got Lyme from that tick bite is weeks or a month later, when you can see that the antibodies are there or not. So during that month, during those weeks, I mean, there's anxiety, there's dread, there's what should I do? Should I take this or should I take that? Should I take this drug? Should I take these herbs? What should I do? And in a lot of instances, you might be able to allay those anxieties and fears and have a better understanding of the situation if you actually captured the tick, which you should do, I believe. And then if you had it tested, which I believe you should do as well. Now, If the tick was on you and just wasn't climbing, and it was not attached, I mean, that's a different story. If you if the tick was just on you and just became embedded just right away, that's a different story as well. But if in these situations where you find the tick, I think I think at least for me, it has been quite useful to send the tick in and for the labs to tell me, do you none of the tick-borne illnesses that we know about exist in this tick, or this tick is full of it has like two or three or four different bugs in it that cause tick-borne illnesses. So that information is really actionable. In other words, like for me, I you know I live in I live in Massachusetts, which means there are ticks around, and the ticks, uh, uh, let's say half the ticks have some kind of disease, or half don't, or a third do, or two-thirds don't, debating on which tick and which disease we're talking about. But to be able to say, it gives me comfort to be able to hand in a tick and within that same day or the next day to find out that yes, this tick did not have any of the bugs that we know about, and therefore I usually don't. It lets me know that over this month, if I get sick, it might not be from the tick at all. It might be, maybe we should do a flu test or a COVID test to see if that's what it is. So the I've used different labs, but the lab that I use the most and has become the most consistent for me happens to be in the town I live in, of all things. Um, I don't know the people. I have no financial relationship with them. It's just I live in a university town that has five different colleges and universities, and there's a lot of research that happens here. Some of that research was around ticks and tick-borne illnesses, and so the researchers would test and test and test many ticks. And if you were in town, you just bring it into your university, and they would tell you if the tick had a disease or had a tick-borne viral bacteria, whatever it had in it or not. And, and eventually that turned into a business where they test 20,000 ticks a year from all over the world, actually, so mostly from the Northeast. They happen to be very fast. They're very good. They're very precise, and you get a report, and they're pretty cheap. So I'll put a link in for that as well. And so the experiences I've had over these years is that the patients that I've had a tick pulled off in the description that in the type that I mentioned, the gorge and so on, they'd send the tick in. That next day they'd have a picture of the tick, a description of the tick, the stage of the tick, how engorged it was, and then all the different bugs that they tested for, depending on what you asked them to test for. So a lot of times the ticks did not have, in fact, I had this experience a couple of times just in this last week. The ticks did not have any of the bugs that cause tick-borne illnesses, and it provided a great amount of anxiety to go away from my patients. And so yeah, I think it's worth doing. I think it's worth doing. Obviously, again, not not ticks that don't attach to us, not ticks that are just attached to us. Not, but you can test any of them, even if they were attached just for 10 minutes or an hour, and you could just see this has a bug, this has this bug, or this does not have this bug, this bacteria in it. And depending on what the answer is, then at least you can tell your physician, last week I was bitten by this tick, which had carried this bug, and different tick-borne illnesses present slightly differently. So knowing which one you have, I think, is quite useful. for the physician as well to be able to ascertain whether there needs to be some kind of preventive work done or whether the symptoms you're having currently match up with the bug that they found in that tick. So I think I said it, um, just to say it slightly differently. There are ticks, and you can test them to see what bugs exist on that tick. If the tick bites you, it doesn't mean there was a transmission that happened, but if it's engorged and there's fluids that got passed, it's possible that uh, bugs that the tick was carrying is in you now. And then we would know what those bugs are. A few weeks later, you can test for those bugs easily by looking for antibodies. And the longer the you know, the next day, you're not going to test anything because your body's not reacted to it yet. But as the days and weeks progress, then your body starts to react to the tick-borne bug, whatever it is, and as it's producing its effect, your body's reacting to it, you're creating antibodies, and then that's what we usually test for and say, oh, you have Lyme disease or you have this bug or this bug. So that takes time, but in that in between time, if you knew what bugs were in the tick, I think it could give you a sense of a pathway and how to proceed. So I'll put a link into that lab. They're very nice. They're very courteous, as you would expect. University started sponsored places. All right. But if it wasn't like that, if you weren't going to get the results right away, and if it was a sloppy sort of lab, I totally agree with CDC. It's you might as well just wait to see what you have. Hopefully, there's a lab near you as well. That's very good. But if not, consider using these folks. All right, onwards. Have a good summer. Bye bye.